Today I'll be presenting the pros and benefits of safe consumption sites. To start off, let's introduce what safe consumption sites are and get an understanding of the general background. Safe consumption sites are a form or a mix of different harm reduction services. They provide a safe space for substance users to consume, inject, or inhale an illicit substance or drug in a safe and monitored environment with no criminal penalty. There are many goals to these services, but the primary goals are to prevent fatal overdoses and transmission of infectious diseases. The first facility to open in Canada opened in Vancouver in 2003. Additionally, safe consumption sites are supported by the following organizations: Canadian Nurse Association, Registered Nurse Association of Ontario, Canadian Medical Association, Canadian Association of Family Physicians, Canadian Public Health Association, and the World Health Organization. So what services are offered at these facilities? Canadian supervised consumption sites offer clean and safe drug use equipment, drug checking to ensure that there are no harmful substances or tampering of drugs, access to safe disposal of drugs and drug equipment, medical care for minor needs, wound care, and emergencies, such as overdose, allergic reactions, or heart attack, infectious disease testing, such as HIV, hepatitis C, or STIs, mental health treatment and education on harmful effects of drug use, and referrals for health services, as well as social services. Between 2017 and March 2023, there were about 4.17 million visits at Canadian supervised consumption sites, with an estimate of 2,600 visits daily. There are around 340,000 Canadians that utilize services provided by supervised consumption sites. To date, there are 38 supervised consumption sites operating in Canada. So who's using consumption sites in Canada? According to Health Canada, 30 to 39-year-olds are the most frequent clients at consumption sites. As for gender, about 69% are male, 24% are female, and 7% are non-binary or unknown. Safe consumption sites offer various advantages and benefits to both substance users and communities. To demonstrate, we will further investigate on the benefits and evidence related to reduction in overdose deaths, readily available health services and treatment to substance users, and improved public order. The first argument demonstrates the evidence in overdose reduction resulting from safe consumption sites. According to Health Canada, Canadian supervised consumption sites assisted with 47,000 drug-related medical emergencies, including drug overdose. As evidence, we will examine data from patients who are unresponsive and apneic following opioid overdose from a single supervised consumption site in Vancouver, BC. This data is from January 1st, 2012 to December 31st, 2017, and consists of 767 patients. On average, the age was 43 and 81.6% were male. All patients received oxygen and ventilation. 715 patients received naloxone. 8 patients required and received chest compressions. All patients who completed a follow-up, which was 99.5% of patients, were alive and well by the end of their visit. 191 patients were transported to a hospital. 15 patients required more naloxone once leaving the supervised consumption site. 16 patients experienced complications, and 1 patient was admitted to the hospital. Secondly, safe consumption sites are beneficial because they provide access to professional health services, treatment, and referrals. These services offer clean and safe syringes and supervision from healthcare professionals. A significant benefit includes a reduced transmission of infectious diseases and bacterial infection with clean and safe syringes. Canada's Insight Clinic shows that it prevents more than 80 HIV infections yearly, which saves around $13.7 million yearly in HIV-related care. Furthermore, drug checking services are available and carried out by healthcare professionals. Lastly, improvements in public order and safety is accomplished with the implementation of safe consumption sites. Research demonstrates that safe consumption sites results in reduced consumption of drugs and litter and drug equipment on streets. The Canadian Clinic Insight provided data demonstrating an increase in public safety due to the clinic. The research shows that within 10 blocks of the clinic and 12 weeks after opening, public drug injection decreased from 4.3 to 2.4 on a daily basis. Public discarded syringes and other drug-related litter decreased from 11.5 to 5.4 on a daily basis. Although the evidence to support these clinics and facilities demonstrates numerous benefits and advantages, there is a remaining stigma surrounding substance abuse and opening the door for easier access to drug and substance use help. According to the Globe and Mail, Nano research studies showed that 74% of Canadians support the function of safe consumption sites, but 48% of Canadians supported cutting back on the resources used to help support substance abuse treatment. Additionally, in 2019, an estimate of 17% of Canadians with a substance use disorder did not seek treatment due to judgments and negative opinions from the community. After analyzing this research, one recommendation I can suggest is careful choice of words and avoiding words such as addict, abuser, and clean and dirty to refer to toxicology reports, and to implement person-centered language. These guidelines can demonstrate compassionate attitudes towards those with substance use disorders.